for the people of Dadaura community and environ in Kauru local government area of Kaduna State, Friday 13th January 2023, remain a day to remember. The people were thrown into wild jubilation as they rejoiced endlessly in celebration of the brand new ultra-modern 120-bed mother and child hospital constructed and handed over to the state government by the Office of the Senior Special Assistant to the President on Sustainable Development Goals for the use and benefit of the people. The 120-bed mother and child hospital is equipped with state-of-the-art facilities, which includes operating theaters, recovery rooms, private and general wards, scanning room, consultation rooms, and laboratory, ultra-modern machine, vacuum extractor delivery set, and an emergency cart with full complements. The facility, which is one of the over 25 of such advanced medical facilities being established across the country, also has quarters for doctors in addition to an intensive care ambulance and another well-equipped ambulance. Senior Special Assistant to the President on Sustainable Development Goals, Princess Adejoke Orilokpe Adefuliwe, in her remarks at the commissioning and handover ceremony of the facility, noted that the project is a strategic intervention directly linked to the achievement of SDG 3 on quality health and well-being for all, as well as other cross-cutting SDGs. She added that interventions like the mother and child centers are also necessary to stop the primary and secondary effects of COVID-19 pandemic from reversing decades of human development gained through the SDGs.
Based on the President Mohammadu Buhari promise to lift 100 million people, Nigerian people out of poverty in 10 years, we are committed to prioritizing key interventions with multiplier effects on multidimensional poverty, such as basic healthcare, vocational skill for life skill development program, and provision of qualitative education. With COVID-19 pandemic challenging our healthcare system, strategic interventions such as mother and child center and primary healthcare center have become imperative indeed. Primary and secondary effects of COVID-19 pandemic will revive decades of human development gains and undermine the achievement of SDG unless immediate action is taken and sustained. And that's what we are doing here today. The 120-bed mother and child center to be commissioned shortly is equipped, fully equipped with state-of-the-art facilities, and they include 2 operating theaters, which you will see very soon. It has a recovery room. It also has private and general wards, scanning room, consultation rooms, laboratory, ultrasound machine, vacuum extractor, delivery set, and emergency card with full complement. This service is directly linked to the achievement of both 3 of the SDG, which is qualitative health and well-being for all, as well as cross-cutting SDGs.
As Princess Orilokpe Adefuliwe noted, with its commissioning, The 120-bed hospital joins other such facilities already delivered by the Office of the Senior Special Assistant to the President on SDGs and are being put to good use to save lives across the country. She added that health and well-being are a cardinal part of the Sustainable Development Goals. Its centrality underscores the saying that health is wealth and that a healthy people are a wealthy people. The interlinkages of the goals suggest that with good health, there is a high tendency of economic growth, which will in turn give room for reduction in hunger and poverty rate.
Our office and Kaduna State government has worked closely and tirelessly to construct and furnish this state-of-the-art facility as a strategic tool for healthcare services, positioning it in the state. It is therefore expected that Kaduna State government and indeed other state governments benefiting from this such intervention will make judicious use of this facility in a sustainable manner for the benefit of our people, not only in Kauru local government, but other adjoining local governments.
Princess Orilokpe Adefuliwe further opined that at the heart of the 2030 Sustainable Development Goals is equity, which is enshrined in its slogan of leaving no one behind. To this end, countries such as Nigeria, in pledging to the SDGs, have committed to the actualization of this vision with Goal 3 of the SDGs, focusing on ensuring healthy lives for all and at all ages. The goal also places equity as a central issue in health towards ensuring easy access to affordable healthcare as a way of bringing some level of balance, especially among the poor population.
Let me conclude this address by reaffirming the commitment of Mr. President to the achievement of SDG by year 2030. We will continue to prioritize interventions with potential impact on the life of the poor and vulnerable members of our society, so that no one will be left behind.
Malam Nasir Ahmed Erufai, who recently commissioned the hospital, while speaking at the event, which was well attended by top government functionaries, traditional rulers, and other stakeholders, also noted that the facility will provide the needed health care for numerous residents in the state. The governor was represented by his Commissioner for Budget and Planning, Umar Yusuf Aboki.
It is with great pleasure I welcome you to the commissioning of the 120-bed Mother and Child Center, built by the Office of the Senior Special Assistant to the President on SDGs here in Dadaura, Kauru local government area. Since 2015, our administration has committed to making Kaduna great again and leaving no one behind. This is evident to the numerous projects executed for human capital development and improving the welfare and well-being of the citizens of Kaduna State. Health is a key component of human capital development, and therefore the Kaduna State government has consistently allocated a minimum of 15% of its annual budget to the health sector. In line with Sustainable Development Goals number 3, good health and well-being, several programs and projects have been initiated to enhance access to nutrition, good health, essential health services in our quest at achieving universal health care coverage. The building and siting of this hospital in this location is strategic and intentional to provide good health to our citizens in and around our local government. Our vision to achieve equity and inclusive growth ensures that the neglected and most vulnerable segments of our population have access to good health care and other social amenities required to move up the social ladder, with women and children making a significant portion of this group. This is to ensure no one is disadvantaged either because of religion, ethnic background, or other barriers. Maternal and infant mortality is a serious health challenge in developing countries. The provision of essential health services for women and children will assist us to curtail the high prevalence and incidence of such mortalities in our local communities. Therefore, the administration took it upon itself to renovate, remodel, and equip 255 primary health care centers in 255 wards of the state, so that our people will have access to quality healthcare services without the need to travel long distances. In 2022 also, we signed a contract with Zipline, which is an American company, to deliver medical supplies to health facilities in hard-to-reach areas through drone technology, and provided about 2 billion naira for health insurance for the vulnerable population of Kaduna State in the 2023 budget. We have also recruited qualified health personnel to strengthen the workforce at the primary healthcare levels, as well as for this edifice that we are commissioning today, and began deploying mobile-first electronic health record system to enhance health delivery service. It is our expectation that these efforts will contribute to providing pregnant and breastfeeding mothers the health care they need and give every child in Dadaura and other neighboring communities access to good medical facilities and a better start in life. Access to essential health services is a fundamental right of every human being, and our government has taken the responsibility to ensure that no child, pregnant woman, loses their life due to poor health care.
The Kaduna State Governor expressed his sincere appreciation to President Mohammadu Buhari and Office of the Senior Special Assistant to the President on Sustainable Development Goals, or SAP SDGs, for the hospital project. He also reiterated the commitment of his government to the achievement of SDGs and on human development.
At this juncture, once again, I must thank the Office of the Senior Special Assistant to the President on SDGs for choosing Kaduna State to execute this laudable project, as well as the one they're building in Zaria, and also appreciate the SSAP's commitment to build an additional one in the local government. We look forward to more development partnerships in the future in a commitment to leaving no one behind.
In healthcare delivery, leaving no one behind implies that issues of health inequalities is expressed by promoting universal health coverage to ensure that people, especially in rural areas, obtain the health services they need without suffering hardship. It also includes health protection, promotion, prevention, treatment, rehabilitation, and palliation.
To the community, this is a huge investment, and thus I urge you to take responsibility and ownership of this hospital. Make judicious use in a sustainable manner and ensure you protect it, and it serves the purpose for which it was built, for the benefit of all. With the commission of this hospital, we again reaffirm our resolve and commitment of building a resilient and sustainable community, one of which is by providing healthcare to residents of Kaduna State through the commissioning of this 120-bed Mother and Child Center, named after our President, His Excellency, the President of the Federal Republic of Nigeria, Mohammadu Buhari, GCFR, today, for the benefit of all and for the benefit of humanity. May God bless Kaduna State. May God bless the Federal Republic of Nigeria.
While the government had in the principle and spirit of sustainable development goals aimed at leaving no one behind, continued to invest in pro-poor and pro-development programs and projects, Dadaura community and Kauru local government area had always come last in every need assessment study carried out since the commencement of the implementation of the SDGs. This, according to the member representing Kauru Federal Constituency, Honorable Mukhtar Chawai, justifies the siting of the Mother and Child Hospital in Dadaura as it will bring the needed solace and succor to the community.
In 2015-2016, at the advent of this administration, when a household survey was done, this local government came last in every single index of development.
Yes!
Every single one, unfortunately.
It's true! It's true! It's true!
Alhamdulillah, this hospital is going to bridge that gap. At that time, we had the poorest facilities in terms of health care. At that time, 37% of our people accessed drinking water through rivers and streams. At that time, 38% of our people engaged in open defecation. At that time, we had the lowest number of enrolled students in our schools. Alhamdulillah, as I speak to you now, with various interventions that had taken place, some of these negative indices are beginning to look positive. This hospital particularly is going to bridge that negative gap. So we really appreciate the federal government and the state government for these interventions.
Some of the traditional rulers and distinguished guests who spoke on the significance of the projects to the state also thanked the federal government for the laudable interventions, with Emir of Kauru, His Royal Highness Zakari Yau Shehu Usman II, particularly urging members of the community to take ownership, use and protect the facility in a bid to ensure sustainability.
The collaboration between the government of Kaduna State and the Office of the Senior Special Assistant to the President on SDG has yielded positive outcomes over the last few years. I want to appreciate the efforts of Her Excellency, the former Deputy Governor, and the Senior Special Assistant to the President on SDGs, Princess Adejoke Orolipe Adefulori, on her efforts to ensure that this hospital has come into reality.
We are so happy that the edifice is being commissioned today because of the commitment of the government in providing quality healthcare services to all the residents in the state. So we wish to express our gratitude and thanks, and also appreciate the Senior Special Assistant for this very, very important edifice.
Engineer Ahmed Kawu, the Secretary of Program in the Office of the Senior Special Assistant to the President on SDGs, in his remarks, noted that despite the colossal disruption to the global economic development and advancement staged by COVID-19 pandemic, the Nigerian government has continued to make remarkable efforts at initiating and executing various pro-poor and pro-development projects across the country, aimed at helping Nigerians cushion the dragging effect of a pandemic, as well as closing the implementation gap and fast-tracking the actualization of the Sustainable Development Goals in Nigeria.
I wish to express our gratitude to the Chief SDGs Officer of the Federal Republic of Nigeria, Her Excellency, the SSAP to Mr. President, for her very thoughtful leadership and guidance. Your Excellency, Ma, you have continued to provide the necessary leadership skills and also struggling to make sure we have enough resources in handling these projects, not only in Kaduna, but across the country. We assure you of our continued support as a team working together with you.
But the vertical collaboration between the Office of the Senior Special Assistant to the President on SDGs and Kaduna State transcends beyond the delivery of the 120-bed mother and child hospital in Dadaura. The office and Kaduna State have also collaborated on policy designs and implementations. At the second edition of the State SDGs Summit, tagged Kaduna State SDGs Summit 2.0, and with the theme, Achieving the SDGs in the Decade of Action, both Governor of Kaduna State, Malam Nasir Ahmed El-Rufai, and the Senior Special Assistant to the President on SDGs spoke on the various robust areas of collaborations. The summit was organized to increase awareness, renew commitment, and mobilize resources to accelerate the achievement of the goals. The summit also offers a platform for stakeholders to share information on key achievements since the domestication of SDGs. Governor El-Rufai highlighted the policy response of his administration in achieving some of the SDGs.
And in our drive to achieve the SDGs, we not only transited to that, but we started by generating necessarily baseline data to understand where we stand in relation to the global goals and to help guide policy implementation to target the deepest and most consistent pockets of poverty. This data that was generated helped our state to develop clear action plans on the way forward, especially with regard to the implementation of the SDGs. We did so by fully integrating the SDGs in our first State Development Plan, 2016 to 2020, as well as the current State Development Plan, 2021 to 2025, which was really geared towards achieving inclusive economic growth and socio-economic transformation. To track the implementation of the SDGs, we produced a comprehensive report, the 2017 SDGs report that we launched in New York, the United Nations, on the sidelines of the UN General Assembly on the 20th of September, when we became the first subnational in the entire world to present an in-depth analysis of our SDG strategies and data for the 72nd National Assembly. We unveiled that report in 2017 to show our commitment to explicit, measurable, and ambitious targets by 2030. And we adopted a common development agenda with the rest of the world to signal our willingness to collaborate with a wide range of actors to jointly improve the lives of our citizens, particularly the poor.
Also, the Senior Special Assistant to President Mohammadu Buhari on SDGs, Princess Adejoke Orilokpe Adefulere, said that the federal government had intervened in different SDG programs across the country, including supporting the sub-national governments to mainstream the SDGs in their state development plans and policies. She also disclosed that one of the projects in Kaduna State was constructed and equipped of a 120-bed hospital in Kaduna community, ready for commissioning January 13, while 2 more hospitals will be built before the end of the current administration in Kaduna State.
I'm delighted to be here today to provide an update on Nigeria's implementation on the 2030 Agenda for Sustainable Development. Indeed, when the world leaders met during the 78th session of the United Nations General Assembly to adopt the 2030 Agenda for Sustainable Development, they are very clear that they wanted a world that is economically sustainable, socially inclusive, and environmentally resilient. This vision was expressed through the framing of the 17 Sustainable Development Goals that has 169 targets and 230 key performance indicators. Broadly, the SDG are universal call to action to end extreme poverty, to safeguard the planet, and ensure that all people live in peace and prosperity by 2030. Your Excellency, very distinguished audience, in 2015, Nigeria, like most other countries, adopted the United Nations 2030 Agenda for Sustainable Development as a vehicle for freeing humanity from poverty, securing the healthy planet for future generations, and building peaceful and inclusive society as a foundation for ensuring a life of dignity for all. This agenda commits stakeholders to work together to promote sustained and inclusive economic growth, social development, and environmental protection while leaving no one behind.
The Deputy Secretary General of the United Nations, Amina Mohammed, and the former Emir of Kano, His Royal Highness Sanusi Lamido Sanusi, SDGs advocate, in their remarks, lauded the implementation of the Sustainable Development Goals and given it the needed action at the local level.
Actions taken at the local level to create a sustainable world will reverberate globally. Let us continue to work to unleash the power of local action to bring sustainability to our communities and together build a resilient and a sustainable future that leaves no one behind.
As a UN SDG advocate, I have been focused primarily on SDG 4 and SDG 5. Kaduna State has been a role model in terms of promoting gender equality and the participation of youth and women in its government and encouraging diversity. I've also been impressed by the amount of work the state has put in as far as education is concerned and the improvement in the quality of teachers. As chairman of the Board of Trustees of the Nutrition Society of Nigeria, I have been concerned at the data that has been coming out of northern Nigeria on malnutrition. Chronic malnutrition affects the intellectual capacity of our children and also limits their potential for academic performance in the future. I'm happy to see that the state government, through its school feeding program and its nutrition program, has focused on that. Having an SDG summit at this point shows leadership, because at the end of the day, the long-term future of this country depends on the quality of its people. We have to think beyond elections into the next generation. We have to invest in the healthcare and nutrition and education of our people. We have to focus on gender equality and make sure that our girls and our women have all the opportunities that they deserve.